MDNews Network recently visited Nashville, Tennessee to attend the Healthcare Information and Management Systems Society's Summit of the Southeast. At the HIMSS conference, we had the rare opportunity to speak with physicians, politicians, hospital CEOs, CMIOs, and CIOs, as well as HIMSS executives and healthcare information system vendors. We spoke with them about a number of things, including the present and future of electronic medical records, how physicians are shaping the future of healthcare, hospital progress in EHR implementation and computer physician order entry, and much more. Here's what our cameras captured.
With physicians not receiving training in medical school about how to use IT, it's a fallacy to then conclude that they somehow are not technophiles. That's absolutely a fallacy. Physicians are strong technophiles, very early adopters of technology. However, physicians, being one of the, as a demographic, very highly educated and very intelligent individuals, are sort of in the camp of fooled once, shame on me, right? Fooled twice, or fooled once, shame on you, fooled twice, shame on me. All right? So when technology doesn't work for physicians the first time, now they're leery. When it doesn't work for them a second time, then they're probably turned off. And it's very difficult for that audience then to return and to try something again. And this is a long history within the healthcare information technology field, is that technologies have been promised to physicians to have far higher usability and efficacy than they actually did. Over-promising, under-delivering, absolutely.
Medicine really has grown beyond this sort of individual interaction with yourself and a single physician. It's a much more complex thing, and even simple things involve bringing together and coordinating a lot of different pieces of the healthcare system. I think that if the policymakers get more demanding of quality and consistency, physicians will, of their own volition, adopt these, because these are the tools it will take for them to respond to that demand. I think of it like if you think about building airplanes, Boeing uses computers everywhere, not because there's government grants to buy computers or because their customers are telling them they have to. It's because if they don't, Airbus will, and Boeing will not succeed. We need to bring some of the same pressure to bear in the healthcare industry so that physicians and physician groups and hospitals invest in this stuff because it helps them to do their business better, not because somebody's pressuring them to.
Now that we're in this new world where physicians who bill Medicare and bill Medicaid are being given this carrot and stick from CMS, they say it's a voluntary program, but if you don't volunteer for the program, you're eventually going to get penalized, right? So now they are basically being voluntarily encouraged to adopt IT. We want to make sure that physicians have at their disposal guides and help in making smart acquisition decisions, smart implementation decisions, and smart optimization of the use of those systems.
I think the revelations that people have had are everybody's probably looking at the other guy thinking they think it's easy for me. And now everybody, I really do believe, has come out of this saying, wow, it's just as hard for the biggest hospital to the smallest hospital. Certain questions I've seen in the panels that have come across have been precisely around how would a small hospital handle that, or how would a large hospital handle that? And I think the questions are really opening people up to see that it's just a challenge for no matter what size hospital you are.
This issue of culture change truly is the big one. It is, I've frequently said, it's a lot like adopting a child. It changes your whole life, and in the end it's very rewarding, but very painful sometimes and difficult in the process, because all transitions are.
The one thing that physicians can do to help themselves is to get educated. There are some excellent resources available on the steps that you need to think through as a physician on your road towards acquiring, implementing, and using IT. Many of the medical societies are really stepping up to the plate. They're opening departments focused on information technology, and they're working closely with HIMSS because we've been doing this for a very long time. So education is absolutely key. Physicians need to turn to their medical society and turn to HIMSS and start to access some of this great education that's out there. There's learning management systems that the various societies have that their members, either through the medical society or through HIMSS, can access. And so 24/7, a physician can get the education that he or she needs without ever leaving their family room or their office, right? There are briefs and abstracts that physicians can be downloading off of the web. There are regionally based programs, like, for example, at this program here in Tennessee this morning, there was a physician breakfast. So physicians could come together and have a collegial discussion regionally of what's going on for physicians in this area and how IT is impacting them, and just sharing stories. Those are all great ways for physicians to start to get very well equipped.
Now that you've heard the HIMSS conference attendees' opinions, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.